grapples with the coronavirus outbreak, Italy remains one of the country's hardest hit. More than 2,500 people have died there from the virus. The country currently remains on lockdown in an effort to curb the spread of the coronavirus. But so far, this has not stopped new cases from forming. On Wednesday, the country saw an additional 475 deaths due to the virus. Italy is now reporting that 99% of those who have died due to the coronavirus in the country have had at least one underlying illness. With us now to discuss is Dr. Luiza Petre, a cardiologist. Dr. Petre, thank you so much for being with us.
Good morning, Vanessa. Glad to be here.
So as we mentioned, Italy is reporting now 475 deaths just yesterday. They are over a week into this lockdown. Why are they still experiencing such high numbers?
Yes, that's true. Italy behaves a little bit differently than what we've seen in South Korea and China. And an Italian study came out that showed that actually comorbidities are related to most of these deaths. But this is actually true in medicine in general, because people with chronic medical conditions like diabetes, emphysema, heart disease, or diabetes have a weak immune system and they have limited resources to withstand such a stress. The ice is very thin for these patients and they can down spiral very quickly. However, in Italy, 99% of these people who died have had at least one medical condition, and they're over 80 years old. Also, we've seen a higher mortality rate than the rest of the country hit by this virus, like China and South Korea. They are close to 8%. And what that reflects is an overwhelmed medical system, under testing, and also Italy has a different demographic. They have the oldest population in Europe, with at least 1/4 over the age of 65. And basically, this story can be like a canary in the coal mine for the United States, because we do have a lot of elderly here as well.
All right, so that puts the numbers into perspective in terms of the demographics there. But why is Italy, out of all of the European countries, being hit especially so hard by this virus?
I do think they started testing a little late. They are not as aggressive or proactive early on. That's why everybody's talking about the importance of flattening the curve. There are some reports that Italians did not take this very seriously at the beginning and just intervened a little bit too late. And that's what we try to avoid here in the United States.
Now let's break down who's getting sick there in Italy. It is clearly impacting older people more so. How is this driving the rate of infection up?
Please repeat that. I didn't hear that.
Sure. So as we look at this breakdown, as you mentioned the numbers there and the demographics, it's clearly impacting the older demo far more than the younger. But how is this driving the rate of infection up?
I think the rate of infection is probably the same. What we see, it's kind of a tip of the iceberg, just because older people and those with chronic medical conditions have more symptoms. So we kind of skewed, we look more at that population group. But I think the infection rate, it's the same basically.
Right. Okay. So Italy is also reporting now that 99% of those who have died had at least one underlying illness. They say more than 75% had high blood pressure, about 35% had diabetes, and a third suffered from heart disease. Doctor, how do these diseases impact someone with the coronavirus?
Bottom line, when you have another medical condition, your immune system is weaker. There is a increased inflammation rate, and all these comorbidities limit someone's ability to recover from such a significant illness.
And doctor, do you think we're seeing something like this in other parts of the world, something similar in other parts?
What I've noticed actually in Wuhan, mortality was actually high, close to what we've seen in Italy, and it was around 6%, while in the rest of China was only 0.6%. And again, we are reaching that tipping point when the hospitals are overwhelmed and they can start closing the doors and ration the care, and that's a time when mortality actually spikes. So why we see higher rates in Wuhan and Italy is just because they reach their healthcare capacity.
Dr. Luiza Petre, thank you once again for your time and perspective here on Cheddar. We appreciate it.